Hello all, this is Dr. Shilpi Reddy and we're going to talk about dense breasts. Yes, this is one of the findings of mammography and women have lots of questions on this. What do you mean by dense breasts? Breasts per se have three kinds of tissues. One is glandular, the second one is the connective tissue, and the third one is the fat tissue. Whenever they have relatively high amounts of glandular tissue and fibrous connective tissue and low amounts of fatty breast tissue, they are called as dense breasts. And how do you know whether you have dense breasts or not? Only a mammogram can show if a woman has dense breasts. Even by self breast examination, you cannot find out whether you have dense breasts or not. And even on clinical examination, you cannot find out whether you have dense breasts. For this reason, dense breast diagnosis are only mammographically detected. And how common are the dense breasts seen? Nearly half of all women aged 40 years and older who get mammograms are found to have dense breasts in certain places. And breast density is often inherited, but other factors can also influence it. Factors associated with lower breast density are including, increasing age, uh, having children, using tamoxifen. All these have a lower density effect. And factors with higher density effect are usually postmenopausal women with hormone replacement therapy and people with a low body mass index. And how is the breast density categorized? If we have to categorize breast density, doctors use the breast imaging reporting and data system called as BIRADS to group different types of breast density. And this system is developed by the American College of Radiology and helps doctors predict and report back mammogram findings. According to this, doctors who review mammograms, who are called as radiologists, BIRADS classifies the breasts into four categories: the category A, category B, category C, and category D. The category A is almost entirely fatty breast tissue, and it is found in about 10% of people. And category B is scattered areas of dense glandular tissue and fibrous connective tissue, and scattered fibroglandular breast tissue. This is found in about 40% of women. And category C is heterogeneously, different areas of breast tissue with many areas of glandular and fibrous connective tissue that is seen. And this is found in again about 40% of women who undergo these kind of mammographic studies. And extremely dense fibrous tissue, which is called as extremely dense breast tissue, is found in about 10% of women, and this is called as category D. And dense breast tissue means that you have either category C or category D, extremely dense breasts. So this is about the staging and category of breast tissue. And does having dense breast tissue affect women's mammogram, is people ask. Yes, mammographic findings of dense breast tissue women are not very clear. And because of the breast dense tissue and some abnormal breast changes such as calcifications and tumors, they get masked and they're not very clearly seen. As a result, the mammography becomes very less sensitive in women with dense breasts. So we have to be really watchful and we need to take care of diagnosing these kind of lesions, if there are any, with additional measures like 3D mammogram or MRI, and substitute it with a higher degree of ultrasound examinations. And more often with fatty breasts, these kind of problems are seen. and they even at times miss breast cancer if you have these kind of dense breasts. And uh, uh, and are the dense breasts a risk factor for breast cancer? Yes, women with dense breasts have higher risk of breast cancer than the women with fatty breasts, and the high risk increases with increase in breast density. This increased risk is separate from the effect of dense breasts on the ability to read a mammogram. So it is not only about the mammographic difficulty, this is another additional risk factor also. So, are breast cancer patients with dense breasts more likely to die of breast cancer? This is another question that people ask. The research says no, this incidence is the same. So, with dense breast tissue or without dense breast tissue, the incidence of cancer, morbidity, and mortality is almost the same. And should women with dense breast tissue have additional modality of screening other than the mammogram, is what people ask, because now mammography is difficult to find out lesions in dense breast tissue. Do you recommend any other test? Then, as a part and parcel of routine screening, we do not have any other test. But if you suspect a lesion, definitely 3D mammogram or a digital mammogram, or MRIs, or targeted biopsies, these can be used as an additional screening for breast cancer in selected set of population with a very dense breast tissue and certain problems that they are having and diagnosed. And the risk factors increase your chance of breast cancer, and your protective factors that you have lower your chance of breast cancer. So you have to, when you have suspicious problems like fibrous dense breast tissue, then you have to rely on your genetic factors. Do you really have an additional risk factor of breast cancer which you have to monitor? Or you're extremely healthy, you do not have any risk factors, you do not have diabetes, hypertension, obesity, any other risk factors, you do not smoke, you do not have alcohol, then these are protective factors. So normal BMI. So if you have protective factors, then definitely you need not go for additional screening techniques. So it all depends on a clinical scenario on how you go ahead with yourself in terms of monitoring your health. So researchers are still trying to figure out, can 3D mammography be better than the normal mammography for fibrous tissue dense breast lesions, and are any certain patterns that are extra risky with dense breasts. So these are all unanswered questions, and the research is still going on. So for now, dense breasts have to be monitored, and you have to look into your cancer risk factors that you otherwise have other than the dense breast in your lineage, and eat healthy, and live sustainable so that you will have lower risk of cancers.